is if Mr. Smith's respiratory effort is poor, then you can put on gloves and assist him with the bag valve mask. Otherwise, you can encourage him and remind him to take big, deep breaths because we need to hyperoxygenate prior to the suctioning. So either way. You could also help me as my assistant by checking a radial pulse. Is it regular? Is it irregular? And then during the suctioning, check pulses to see, is he going fast? Is he going slow? Has it become irregular? But you're also your tear management. Okay? All right, well, I get organized. We had this problem in the morning. The cup wouldn't open. Don't need a lot of water. This is just to lubricate the catheter and clean out the tubing. I'm ultimately going to move it close because that's where I need it. There's a couple different ways to connect your sterile catheter to the non-sterile suction tubing. I'm going to double check. Suction's on. The whole idea is nice and tight so it doesn't come loose, and then keep the rest of the catheter sterile. Now I can get sterile, but before I do that, put my mask on. I'm right-handed, so I put my right glove on first. All I really care about is my fingers. I don't care about my wrist. And I can fix my fingers once I'm done. And I'm not going to play with that because I'll probably contaminate. So now, staying sterile, not sterile. Voila. Moistening. So you feel like he's been hyperoxygenated?
He's taking deep breaths, yes.
Fantastic. Then you're going to take this away. Okay, this is going to make you cough, Mr. Smith, but get it ready to put back on. Okay, I'm going in pretty quickly. He's coughing, I'm suctioning. Take a look. Is it yellow? Is it white? Is it blood tinged? Is it green? What have I got going on here? Moisten my catheter again. Don't forget about tear management.
Oh yeah.
Oh yeah.
He's tearing up.
Okay. Suctioning, I'm using the continuous method, and I'm also rotating my catheter. I'm also keeping good control of my catheter. Okay, so heart rate, how's he doing?
Heart rate, we're at 80.
Okay, it's regular or irregular?
It's regular.
Okay. Tear management? Excellent. Okay, so quick listen to his lungs. Clear? Yes, clear. Great. O2 stat, 94. Great. So if I was by myself, I could use my non-dominant hand off and on. Off and on. You're beginners. It's helpful to have somebody with you because it's about keeping this sterile. If you're right-handed, it's in your right hand. Left hand, suction on, suction off. Once you're finished with the sterile suctioning, then it's all about oral care. Because look, little, soft. So, go in, your oral care. Maybe a little brush in there, a little something, more oral care. Then when you're finished, you suck up all the water. That cleans out some of this tubing. When you're finished, go off. Things are put away. You make sure your patient's okay. Mask off, done. Clean up everything, trash. So now, over to the easier, not open, but closed system. So now we're going over here to our other mannequin. So to do the closed system, even though it's closed, putting on gloves, great idea. Now, certainly an emergent thing, you just get over there and suction. But generally speaking, you walk into patients' rooms, you already know they're going to have secretions, put your gloves on. You are going to need the normal saline little pillows because you're not going to have a little cup of water. So, Mr. Smith, you've got some gurgles in there. I'm going to verify my suction. Take a few deep breaths for me. I'm going to stabilize right here, and I'm going to go down pretty quickly. And on a mannequin, it doesn't go very deep, but then I'm going to take my hand, suction until I see the black indicator. Now, the reason that you're stabilizing here is because it's really easy to pop this off. So the whole idea is your non-dominant hand stabilizes right here, the connection between the closed system and the trach. That just lays there, Dominant hand, you go in. On a regular person, it goes a little further. He starts coughing, suction, pull, till you see the black line. Now, this is what the little pillow's for. This hook's on here, and timing, squeeze and suction, and it suctions out your tubing. Now, oral care. I don't even have anything in my hands for oral care, do I? And that's the downside in my world to the closed setup. So somewhere in the room, perhaps there's a yank hour taped on the wall, perhaps, but I just suctioned. I feel finished with suctioning. It's so easy to walk out of the room and forget oral care.